that's another resource.
And most of this information that we're talking about here is available on the SA Moves website. So go there to samoves.com and you'll be able to, in one place, see all this information.
Please use the website.
Please use the website. It's a great resource, and we put it together so that you can use it. Just to chime in again with Tony, there are a bunch of support groups available, and they don't charge you a thing. There's APDA support groups, there's Warm Springs support groups who do an outstanding job, and in some of the outlying cities like New Braunfels and Bernie and Kerrville and down between Karnes City and Kennedy, there are great support groups, so take advantage of those. All that information is on the website. And if you want to attend the POP program or Rocksteady Boxing, then we've already got a scholarship program in place that helps you pay for that.
Are there members from the other the support groups here? Are there members? Stand up. So stand up so people in the room can see you, so that they can reach, so that everybody else in the room can reach out to you. And then also for you people, let Corey know when you need someone to speak. We'll get you speakers, we'll get you food. We're helping with a bus to the Davis Sweeney Foundation to push you all to a victory summit. So you just need to let us know. That's what our whole goal is, to help support you.
That's right. And the way to let us know is to use the website.
I also wanted to make mention, and I'll probably look at thinking, on my website I actually have free videos that are available to you at themesiotherapy.com. Some of you were at my table and I was talking to you about that. The breathing activity that we just did, 11 minutes breathing exercise. You only have to do is lie there or sit there, and you can do that, as well as some different activities where you can get an idea of what this yoga practice looks like. Everything on there, if you have access to a computer or your smartphone, you can look at that video page, and it's all free. Come by the booth and you can get that, and we'll probably connect.
We have the first question, which is medicine and exercise. So if you find that when you exercise, your medicine doesn't work as well, remember that the body only has so much blood. So when you exercise, the blood is diverted from the gut, it goes to the muscles to help support whatever exercise. And so it's not available to transport that levodopa from your intestine into the blood up to the brain. So if you find that when you exercise, your medicine's effect is somehow diminished, then take your medicine 30 minutes before you're going to start to exercise, a little before that, so that it's fully absorbed before you divert blood to the muscles from the gut. So that's how I would answer the first question. So, all right, next question.
So could you explain just a little bit more the mechanism of how the carbidopa, levodopa into your system gets on through to the brain and does its job?
Right. So remember that neuron that I had, that dopamine cell? So you take in the levodopa carbidopa. The carbidopa stays in the body, doesn't get to the brain. The carbidopa inhibits an enzyme so that levodopa stays in the blood, because levodopa can get across the brain-blood barrier. If it's converted to dopamine in the blood, dopamine cannot cross the blood-brain barrier. So the carbidopa allows the levodopa to stay in levodopa form once it's in the blood. And it crosses the blood-brain barrier, gets taken up by the dopamine-producing cells that are remaining in the brain, and converted from levodopa to dopamine in that cell. It stores the dopamine, releases it when it's appropriate. And then that dopamine acts on receptors on other cells that then facilitates normal movement. Does that answer your question? Okay. All right, I think now we're going to have the boxing demonstration.
I did think of one more thing about gastroparesis. Liquid meals leave the stomach faster, so smoothies and whey has a smaller particle size, so if you're putting a protein powder, whey leaves the stomach more quickly too. So protein, fruit, vegetable foods.
you want to
what
hide?
you do is either stand up or reach up from your seat above your head, look up, drag your fingertips to the ceiling. Reach, 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 reach. Bring it back down one more time. Reach, reach, and lean side to the other side, and back. When I say 1, 2, 3, does that feel good? Yes? Yes. One more time. Yes? Yes. I've been a strength and conditioning coach and fitness trainer for 35 years, and I can tell you what these folks have already told you. The best exercise in the world is the one you do. I really don't care what you do as long as you do something you enjoy. How many of my boxers are here today? And look around the room, all have hands up. You all enjoy the boxing program? Yeah. That's why they're still there. That's why they're still doing it. Not because it's magic, not because it's some kind of mysterious problem-solving tool. It's exercise. It's intense, vigorous, works, and it's fun. All right? The thing about boxing is it elicits an intensity that does stuff for you. It's not magic, it's strength training. You make people stronger, you make them better. I make people stronger. I'm not that smart, but I know how to make people stronger. I know how to have fun, and I know how to turn an activity into a workable, manageable, positive activity. All right? I need a volunteer. Right? What's your name? Mary Kay. Mary Kay is going to help me with some boxing here today. All right? Have you ever boxed before? Have you ever put on a pair of boxing gloves? Right? Today's your day. Into it like that. We're going to go left hand first. Right? There's a thumb slot there. Make sure your thumb gets into that slot. Right here. There we go. All right.
Knock them out, girl.
Hey, no comments from the chief. All right. Right here. Right now, I want you to come right up here. You're going to basically, I'm going to use some basic instructions on boxing. All right? All right, so this is your start position. All right? This is called the guard. You're going to take your thumbs, align them right about where your cheekbones are. All right? So your left side down and your right side down. Your right. So you're going to use the left foot forward, like I am. All right? Your left hand is going to be your jab. It goes up there, you turn your hand over. You're going to hit these two knuckles. This pattern I'm bringing. All right? So left hand right there, one knife, right there. Okay, now the right hand, same thing. Right there. One more time. Right there. Okay, so this is your jab, this is your cross. Your other movement is going to be a hook. All right, so you're going to lower your center of gravity a little bit. You're going to take the left hand right there. Right there. Now right hand right here. Okay? One more time there. One more time there. All right, those are your two basic punching. All right? Stance. Hands up. Guard position. All right, going to jab. 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 Hook. Right there. Hook. Right there. Jab. One more. Jab. Hook. Hook. All right, now we're going to make a combination. We're going to go left, right, left, hook, hook. All right. Okay. Left. Right. Left. Hook. Hook. Back up. Left. Good. Left. Right. Left. Hook. Right. Right hand. Ready? Left. Right. Left. Hook. Hook. Again. Left. Right. Left. Hook. Hook. All right. Now strong right hand. Strong right hand. Come on. Knock me out. Come on. Knock me out. Now, who thinks they couldn't do that? Right? Who thinks they could not do that? Of course you can do it. If you need to, we can do it from a sitting position. You meet where you are. We work. You want to try some? Go. Yes. I love volunteers. All right, left hand, sir. Slide your hand in there with the thumb slot. There we go. Good. All right, you get the right one on you. What's your name? O'Neill. Tiger on me. Right. So hands up, guard position, all right? Now you're going to go your left hand to my left hand. Right there, good. Now right hand right there. Left hand. Right hand. Knees down. Punch. Right hand. Right hand. There we go. Left hand. Right there. Right hand. Good. Back up. Left hand. Left hand right here. There we go. Right hand. Cool. Go to the target in the middle. Right hand. Left hand. Right hand. Right hand hook. There you go. Left hand hook. Right hand hook. Left hand hook. Now, I want you to punch right and left as fast as you can. Right there. Boom. So you can do this. If you're interested, I'm down here, I've got a piece of paper, give you your email information. You can contact me on my website. It's morethanexercise.com. Corey's got my number. It's probably on the SA Move site. It's on the SA Move site. All right, so if you need to get a hold of me, get a hold of me. I'm soon to have my third location. Right now I've got a location in Schertz. I've got a location down the road here at Fredericksburg Road and Crossroads Boulevard. I'm getting ready to open up a spot out in Blanco and 1604 area. So get a hold of me, all right?
It's on our website. The boxing program's on the website.
All right, I think we have one more demonstration from Melinda, and then we're going to finish with the last fast facts.
I can't follow that. But anyways, so we've been here since 8 o'clock, 9 o'clock. So for those who can stand up, please stand. So stretching. But we're also going to do Lee Silverman voice treatment, which is think big. If you think big, you move bigger. If you think loud, you project yourself louder. So first of all is we stand big. So for those, so you think, you stand big, and for those who are sitting, you keep sitting, but sit big, okay? So there you go. Keep your feet apart if you can, like you're a very tall person, okay? And then go ahead and stretch your arms out, okay? All right? And also for those with this forward head and stoop posture, go ahead and keep your head up, okay? And stand big. And what Nadia said, keep on breathing. Breathe through your nose and out through your mouth. Okay? And down. Alright? There you go. Also, as far as stretching is concerned, the first things that get tight for Parkinson's patients are the hamstrings and also our neck muscles. So we're going to stretch our neck muscles by turning to your right. Turn your head to your right. Smile, and then forward. Turn your head to your left, and forward. Okay, next we're just going to stretch our shoulder muscles. We've been sitting for a long time, so we're going to roll our shoulders forward. There you go. Just feel the cracking of your joints there and your bones. And then back. Just stretch. Just stretch. Okay, there you go. All right, so that's it. The importance of stretching. Before you do any physical activity and physical exercise, please stretch so that you don't hurt yourself. So you prepare your muscles and your ligaments for more exercises. Thank you.
All right, our last fast facts, as is the tradition at these symposia, are to give you an update on the other treatments other than diet and exercise that are either new or in development. So remember, diet and exercise is the foundation. We're going to talk about the next two levels. And, excuse me, at this time, I'm going to ask my colleague, Dr. Alvarez, to provide these next fast facts.
Thank you, Dr. Pepper. Thank you all for sticking around for my part of the talk. So not only we'll talk about the current treatments, we'll be talking about the pipeline drugs coming out of the market pretty soon. So I'm so sorry for those of you who stick around. Marijuana is not in the current pipeline, so don't ask me questions in there. It's not in the outline method. So there are a few slides that I'm going to fast forward. So I'll start with chorea. So I don't know how many of our patients here today have chorea because of Huntington's disease or chorea from different other conditions. As you know, chorea just means dancing movement. It actually came from a Greek word Korean, which means dancing movement. So these patients can have this kind of involuntary movement due to their other underlying conditions. So we have 3 FDA-approved treatment for the chorea, specifically for Huntington's disease chorea. The first one that came out of the market was in 2009, tetrabenazine or xenazine. It's been around and been used for other conditions as well. And most recently, the 2 babies that are similar to xenazine are Austedo or deutetrabenazine or Ingrezza bulbenazine. So Austedo or deutetrabenazine actually has 2 indications now approved by FDA, one for Huntington's disease and one for tardive dyskinesia. Tardive dyskinesia are those involuntary movements that people experience after being exposed to certain medications that can cause the disorder. There are many medications out there, but typically these are either antipsychotic medications or medications that's been used historically for nausea, such as Phenergan or Reglan or Combazine. Then finally, we have Ingrezza or valbenazine, currently FDA approved for tardive dyskinesia. So surgical intervention, is Corey still here? Okay, so as you all know, Corey not only is the president, he has 2 hats, he also is a patient with DBS, and he mentioned that for those of you who ask questions, can ask him, and I appreciate that. I'm also using this opportunity to talk to my patients who are here today and has DBS. If you don't mind sharing your information after the meeting, if you can find Corey, because I have a lot of patients that I talked to in the last few weeks or months, and they are interested in deep brain stimulation surgery. And they not only giving them information that they can read or look up in the internet, and that only information I give them as they come to see me in my clinic, they also feel that they need to speak to patients themselves, like the patient's advocates. So for those of you who have DBS and willing to share, I want to keep your privacy, but if you don't mind sharing, if you'd love to share what you have experienced in your life with Parkinson and DBS, find Corey, because there will be some patients in this room that will be more than happy to hear from you guys. So patients are the best advocates that we can have. So deep brain stimulation surgery is approved as one of the standard care treatment. One thing that I'd like to share to my patient and Dr. Pepper's patients and everybody else's patient, deep brain stimulation surgery, please don't consider it as the last resort, okay? It is not the last resort. I believe it's better to be late than never, but if this is the right time, you should take that opportunity and really consider it, because it can truly improve the quality of your life. So it is not the last choice, okay? So currently we are very lucky because we have 3 options. As you can see here, we have 3 companies that has been approved now for deep brain stimulation surgery. So we can talk many hours about DBS, and we don't have the surgeon here, and I'm a neurologist, so please don't ask me surgical questions. But we do have Medtronic, we have Abbott, and we have Boston Scientific. 3 different companies that have 3 different potential use. So we can go in detail when we see you in the clinic and go over each one of them. And
You decide what is best for you based on your need. So deep brain stimulation surgery by Medtronic. This is the device. So they have this spaghetti-sized electrode that is implanted in the target site, usually the subthalamic nucleus, which is the control for the movement disorders. And people are asking me questions like, how invasive is the surgery? I tell them that I am not Dr. Vardiman, but neurosurgeon consider this like a boring procedure because everything is through the help of a magnetic MRI. And unlike other surgical procedure where they will actually evacuate a hematoma or fix a bleeding aneurysm, they call this a simple procedure. Yeah, those neurosurgeons, that's what they call them, because they really just implant an electrode. For them actually, and I don't know again, I don't have Dr. Vardiman here to confirm this, but the surgeon finds that the most complicated part of the surgery is actually the implantation of the pacemaker or the pulse generator in the chest. Everything is under the skin. And then the second one that's approved by FDA is by Abbott. Again, using an electrode similar to the spaghetti-sized electrode. The goal of this talk is to educate you on the different options. For the sake of time, we will not be going in detail about what makes one different from the other. Me and Dr. Packard or your neurologist can go over this with you on your visit with them. And the new kid on the block would be Boston Scientific. Actually, Boston Scientific, I've been hearing about them since I was a young fellow, but I've been practicing now for 10 years. I'm also excited to see that we have another option in the market. So we do have questions about surgery, and I think for the sake of time, I'm going to finish my slides, and if you have questions, we can talk about it then. So now the next option will be Duopa. This is by AbbVie. The active molecule is no different than Sinemet or carbidopa-levodopa or Stalevo or Rytary. So what makes this different then? Well, as the disease advances, and no matter how much you follow the guideline about taking your medication with lots of water and avoiding protein for about 30 minutes to an hour before you eat mealtime, unfortunately, the absorption of medication is impaired in Parkinson patients. We have this word gastroparesis or gastric retention. It means no matter how much you follow the instruction, the gastrointestinal system just doesn't want to cooperate and the medication doesn't get absorbed. And as you all know, unless it reaches your bloodstream, it's not going to be delivered to the target site, which is the brain. So how can we help this patient get this medication into their bloodstream? Well, we have to trick this gastroparesis, and this is how Duopa is given. So there will be a J-pad, so these patients will go under procedure. There will be like a tube, if you're familiar, to PAG is similar to a pad, but then there's another extension that goes with it that connects to the small intestine, and that's how the levodopa is positively delivered. Do we have a Duopa patient here? No? Okay. So Rytary, so I mentioned it to you earlier. For those of you that like to read names based on their long names, so this is one of the longest acting levodopa we have, carbidopa-levodopa. So it's a combination of a long and short acting. We find that medications that are long acting have tendency to act slowly. But then, once this medication gets in the system, it actually provides patients with a more steady state delivery, so that patients, once they reach the dose that works for them, they will experience that they will have softer off time because the medication has more of a steady release. That's what Rytary is. I find that as a very good drug, but just patience in finding the right dose per patient. But listen, this Parkinson's disease is at least 15 years in development before it even starts producing symptoms. So we cannot expect medications to work overnight. So patience is very important. APOCAN pen, so if you look at the classifications of medications, I'm sure that a lot of you know ropinirole or Requip, Mirapax or Pramipexole, rotigotine patch or Nupro. Well, this is those three medications that I mentioned to you are dopamine agonists. APOCAN is also a dopamine agonist medication, so it works at the end of the nerve, or we call it postsynaptic. And what it does is it helps maximize the effect of dopamine. In other words, like mimic dopamine. So apomorphine or APOCAN is an injectable version of this medication. It works pretty quickly. It can be as early as 5 to 15 minutes in some patients, but it's very, very short acting. So at the moment, this is only for rescue, which can be used several times with a maximum of 5 times a day. In Europe, you will see that this medication has an approval for the continuous delivery, still in the pipeline here in America. So now, newer treatments. How many of you watch television? A lot. So did you see a commercial that 50% of patients with Parkinson will develop hallucination? It's very scary. It can be up to 60% depending on what literature or resources you have. But the most, and what Mike said, is you don't, reassuring the patient rather than contradicting patient is very important. Once it develops, the most important thing is help patients build their insight. Once the patient starts losing insight, it starts affecting the quality of their lives, or even the peace and quietness at home, they should consider medication sooner than later. Of course, in the past, I'm going to go back. I don't know if I can go back. So in the past, people have been using Seroquel or Clozaril, which are still, some of our patients are still using it. They're getting good results with no side effect, but most of the new patients that have not been exposed to antipsychotic medication, we find that these patients are starting on Nuplazid because unlike the other drugs that can potentially worsen Parkinson's disease, Nuplazid works in a totally different mechanism of action, not working in a dopamine pathway, therefore should not worsen Parkinson unlike the atypical antipsychotic. So that's a biggie about Nuplazid. So do you know who this guy is? Okay, so what is he doing? Dancing disco. So guess what the next topic is? Dyskinesia. So as you know, dyskinesia is an abnormal movement, like Dr. Pepper broke down the words for us earlier. So dyskinesia is movement, this is abnormal movement. So dyskinesia can occur in Parkinson in different times. It could be an off episode or on episode dyskinesia. Whenever it's an on episode or off episode, it is easier for us to treat because we just have to adjust the dose based on your symptoms and hours. That's why your history, going back to history, your history is very important. Telling us that the dyskinesia started, it's going to be harder for us to adjust the meds, but if you give us a little bit more information as to when it actually happened, it will give us more, it will narrow down the choices for us for that visit. But the hardest thing is when the dyskinesia becomes unpredictable. It means it can happen at any time. There's no warning. It has no time relation to medication. So now we have an FDA-approved treatment to treat dyskinesia in Parkinson patients. The name of the drug is called Gocovri. This is an extended release amantadine. Given once a day, because it's a long duration of half-life. Again, any medication that's long-acting. Those of you who like to see my hand activity when you're seeing me in the clinic, so these patients, instead of having an up and down mode, they should have like a steady state control of their symptoms once they are long-acting medication. So away from John Travolta, now let's go to orthostatic hypotension. I think there was a lady on my left side that asked a question earlier about dizziness, and her dizziness may be also related to blood pressure. So for those patients that are showing signs and symptoms of orthostatic hypotension, so again, the hypotension can be multifactorial. We're running out of time. I'm going to zoom into NOH, or neurogenic orthostatic hypotension. Typically, this is seen in advancing Parkinson's disease. If it happens in the early part of Parkinsonism, the diagnosis may not be advancing Parkinson's disease, but it may be MSA or atypical Parkinsonism. So for those with orthostatic hypotension, we usually have to get more history from them, and we measure their blood pressure more than once. I like to my patients to get their blood pressure reading for me. Remember, for those of you who have symptoms, I tell them to give me a recording for 1 month, yes, and because if you just do 1 day, a lot of times you won't pick up the problem, or 1 week, even for 15 days, sometimes I'll just pick 1 or 2 days with abnormalities. So I'll tell them to do a 30-day, and then they'll come back to me. The 30-day reading will allow me to have a better understanding of the range of their blood pressure, how high does it go, how low does it go. It gives me an insight too as how much dose to give them. If I decided to give them medication or Thera, which is FDA-approved treatment for this condition. Sometimes patients are on midodrine or Florinef, especially if they are already seeing a cardiologist, because we've been using the 2 older generation drugs for many, many years. And at times, if we're really having a hard time treating their symptom, this patient can even be on 2 drugs or even 3 drugs. I have a patient that are on 3 drugs just to maintain her blood pressure of 80/50. All right, so therapeutic Botox, okay? We're not talking about cosmetic Botox here, because you see Botox picture on the right. So what are the therapeutic benefits of botulinum toxin, particularly biologic Botox using in Dysport for our movement cases? Well, for dystonia. So for dystonia, these are patients with abnormal, involuntary, or excessive contractions of a focal muscle or segmental or multifocal parts of the body. In cervical dystonia, which is a focal dystonia, patients are injected with all these 4 medications. These 4 botulinum toxin brands are all FDA approved for reductions of symptoms. Some of the patients also receive this injection treatment, not for dystonia, but for drooling. That's not yet FDA approved, although we have a lot of data showing that it is effective. In fact, I know that there is one company that's about to get theirs approved, and maybe another company is going to get theirs approval also for drooling. So, pipeline drugs, I told you, not marijuana, so what else is out there? So, here, another carbidopa-levodopa, and you're like, what's up with carbidopa-levodopa? Why do they keep talking about it? Because carbidopa-levodopa is still the biggest drug that we have. It's the gold standard treatment for Parkinson. It's the most effective treatment for Parkinson. I'm just not sure if it's the most effective or is exercise is the most effective, so we have to have a game on that at the end of the talk, but probably they're half and half. So carbidopa-levodopa being the most effective treatment for Parkinson also has to be used gingerly. You have to minimize the dose because too much leads to more unpredictable offs in the future or dyskinesia in the future. So you want to really try to minimize the use of it as much as you can. Try to utilize the other medications like the MAO inhibitors like Azilect or Selegiline, or try to use one of the dopamine agonists, or even use anticholinergics or amantadine to help control symptoms. That way we don't maximize the use of cinnamon or carbidopa-levodopa to minimize or lessen the side effect. But it is the most it's still the most effective, so we have to find ways to deliver it better. Because as the disease advances, up to 88% of Parkinson's patients can have gastroparesis. So no matter how much medication the patient can take, if it's not being absorbed by the bloodstream, it's useless. You're going to go to the bathroom and excuse my word, you're going to pee it out. So you need to, deliver it to your brain. So what are other ways to deliver the medication for patient? Well, we do have phase 3 of carbidopa-levodopa that is designed to prolong the effect in a wafer form. And we do have inhaled levodopa. So these are for patients that have difficulty swallowing. Maybe for those that are in the nursing home that have difficulty calling for a nurse assistance. I don't know, some nursing homes do not allow them to have medication at bedside. So that's the limitations of these rescue medications, because by the time the nurse gets them to rescue them, you know, it's 2 hours later. But that's one of the challenges of going to those places. But if you have a patient that still stays at home and have access to whatever medications they have when they need it, so this is a promising medication, an inhaled form of levodopa. Phase 3. Now we have phase 2, phase 3. This is a pump version of levodopa. It's delivered in the subcutaneous form. In a way, this is similar to the duopa that I mentioned to you, but the other one, you will have a surgical J-pad to deliver this levodopa in a gel form. This one will be delivered, so you will have a small pump and it will be tied around your abdominal waistline. You will have a belt pump. We'll see. We already know that any levodopas, we already know that they are very, very effective. We just have to look for their safety issue profile and, of course, FDA to review the data. So, other thing in the pipeline, this is one of the things that I find really cool, the dopa fuse. Why? Because again, it's any medications that you have to take several times a day, you're going to have peaks ups and downs.